So this is a video to demonstrate how we can use an inline breathing treatment for a patient who is on non-invasive ventilation via the Trilogy 100. So for demonstration purposes, we have a test lung that's attached to the Trilogy 100. So basically just imagine the test lung as the mask on the patient. So you have 6-foot tubing attached to the patient's mask. So you're gonna also need a nebulizer, which is a compressor, small little compressor. This is gonna deliver the medication. So you're gonna make sure it's plugged in, and then in your neb kit, you're gonna have 4 items in there. You have a 6-foot oxygen tubing. It's just regular oxygen tubing. You take one end of the tubing, doesn't matter which end, it gets attached to the compressor. And then you also have a neb kit cup, which is this one is for where the medication goes. You take the other end of the tubing, and that goes at the bottom of the cup. And then you also have a T-piece that's gonna attach on top of the cup. But before you do that, you need to make sure the medication is inserted in here by squirting it in from the vial, and then you put the T-piece on. The reason it's called a T-piece, it looks like a T. And then you also have this 6 inches corrugated tubing. This tubing will not fit on both ends. It only fits on one side of the tubing of the T-piece. So make sure that you insert it in there and make sure it's securely in there so it won't come off. Okay, make sure everything is tightly in there so it won't pop off once it's in line. So now you're ready to give the treatment. You have the medication and everything. All you have to do now, insert it into the inline. But before you do that, you're gonna need to come to the Trilogy and look at the display panel. In the middle of the display at the bottom, you have the menu option with an up arrow. So you're gonna press the up arrow to get into the menu, and then you have options with highlighted areas in it. So if you scroll down, it will get you into that option. So what we're gonna need to do is get into my settings option, and then we're gonna select it. We have 2 options in my settings, and then what you need to do is get into the nebulizer enable. So you scroll down to it, and then you're gonna need to press modify to change it. So once you're in there, then you have an option up and down. To turn it on, you press the up button, that turns it on, and then you're gonna push OK, and then you're gonna finish. So now you're done with that, and then you need to get out of this menu, and then you get out. So now, if you notice, on the right bottom corner, there is an option now, nebulizer, where it wasn't there before. So now, what you need to do is you take your nebulizer, and now the machine is going to alarm because you're going to need to take the patient tubing off the mask. So what you need to do is make sure you press the alarm button here, and then when you press that, you have 2 minutes, and then you take the patient, you disconnect the patient off of the mask, and then you're going to put one end of the tubing into on the other end of the T-piece, and you take the 6-inch corrugated tubing and you attach it to the bottom of the mask. So now this is connected. Make sure always that the cup is in upright position so it doesn't drip, and it also nebulizes much better. So this will look like this. This is the patient's mask, okay? And then what you'll need to do is the nebulizer is, what you'll need to do is press the nebulizer, and now the patient is getting the breathing treatment, and the machine will not alarm. So this will take approximately 5 to 10 minutes on the breathing treatment. Once you are done, you shut off the nebulizer button by pressing it, and then you disconnect the patient, and then you take this off, and that's it.